Our second speaker, Sami Mansfield, is a renowned expert in exercise oncology and lifestyle medicine consultant. As the founder of Cancer Wellness for Life, Sami has dedicated her career to empowering survivors and clinicians through innovative, evidence-based programs to improve health outcomes. With experience in clinical practice, research, and consulting, she's pioneered sustainable wellness strategies which enhance accessibility and bridge equity gaps. Sami is a contributing author to the American Society of Clinical Oncology guidelines on exercise, nutrition, and weight management, and has helped shape numerous state cancer control plans. She's the current chair of the Cancer Member Interest Group for the American College of Lifestyle Medicine, where she drives forward initiatives emphasizing the building the connection between science and implementation. Her patient-facing programs like Build and My Lifestyle Shift have transformed lives across the world. Sami will be speaking with us about the 6 lifestyle pillars for melanoma and survivorship. Thanks so much, Sami, for joining us.
Thank you so much for having me. Really excited to be here. And I think my talk really is a perfect timing on the back end of Dr. Siegel's talk, talking about the lifestyle medicine, because language really is important when we're talking about lifestyle. And as I talk about lifestyle and the different aspects of lifestyle, I also think it's really important for all of us here, whether we are a thriver, a meta thriver, we're in treatment, we're a professional, that just because we don't have a perfect lifestyle or we haven't even thought about what that means, that we shouldn't be shamed for that a lot of what I think lifestyle should also be joy, humor, happiness, things that we love. So we're going to talk about the pillars of lifestyle from the perspective of what they mean. I'm going to skip through some of the more scientific components of this just in the interest of time, really focusing on implementation. But let's start with really a highlight of what is lifestyle medicine from the sense of the clinical world. So lifestyle medicine is truly a medical specialty where we have specialists that are certified in lifestyle medicine delivery that run lifestyle medicine clinics throughout really the world. The American College of Lifestyle Medicine is one of several big organizations, but our group is actually 1/3 global. And so we know that lifestyle medicine is really a global initiative. But I think it's important to know that as an individual, I don't always need to see one more medical professional or have a prescription, so to speak, for lifestyle. And that's really what I want to focus on today, is how to give you some taste and access and tools for lifestyle that you could start with today. And we will actually practice a couple of these together. So there are 6 pillars of lifestyle medicine, and you can see these on your screen. We're going to go through a little bit of what is each of these? What do they mean? What do you do? I have highlighted of the 6 pillars, 3 of them have evidence behind them in the cancer space. I will tell you that overall, the evidence is still lacking. And I don't know if that's going to change. You're going to ask me already, where's the evidence in melanoma? And I will tell you that we have studied melanoma in the context of large groups, but we don't have very specific cohorts of patients. And, I think the biggest thing that I will tell you is that what we do know is that these are successful, supportive, powerful interventions that we may not need randomized control trials to prove safety and efficacy, but I think we'll get there based upon what I'm seeing in the literature. Now, I do want to add that weight management is a key aspect of talking about lifestyle in the cancer space, but it is actually not a pillar. We will talk about it because it is an important discussion for the context of our conversation today. So who can benefit from lifestyle? In the world that I work in, I have 3 big buckets. I think there's a lot of conversation of where this could go, but the main benefits that I want to focus on today are individuals with cancer that have had a diagnosis or going through treatment at any stage. We know lifestyle is very powerful for managing side effects and quality of life. We know that that's very individual, so I'm going to keep that a little bit general for now. We know that our cancer population is at higher risk for other diseases, cardiovascular disease, diabetes, neurodegenerative disease like Parkinson's and Alzheimer's. And we know that these are very, very powerful interventions to improve the health outcomes of our patients after a diagnosis. We also know that the strategies are for physical function. This includes energy, fatigue, cancer's number one side effect, but also weight and body composition, body image, and self-image. And I think these are very important as well. Caregivers really benefit from having access to lifestyle, not only as a caregiver supporting their loved one or the person they're caring for, but for themselves. And so I do not want to forget the aspects of self-care in this space. And then last, but definitely not least, I want to really reiterate the importance of lifestyle for professionals, especially in the healthcare space. We have seen through a lot of our research that individuals as healthcare professionals, such as myself, who has been in clinics, when we practice these principles, not only do we have better physical and mental health, we have less burnout, we have more resilience, we tend to be more comfortable talking to colleagues, peers, and patients about this as well. So no matter how or why you're here, this is definitely a talk that is going to be beneficial. So I like to start a lot of my kind of talks over the last couple of years by asking people, are we missing the forest for the trees? And what do I mean by that is simply this. When we focus on a tree, so to speak, in lifestyle, it might be, what is the diet I should follow? Biggest question I got when I was in clinical practice, even as an exercise professional. But Sami, tell me, what should I eat? What's the nutrition look like? And I really want to remind you that there are certain trees in the forest that are very beneficial, but they'll be very individual. And so I want us to think today about stepping back and looking at the forest, because the path that you need to be on will come from this conversation today, and it's going to look differently for everybody. And I have my sort of chimpanzee picture up here because I want to say that often we get very distracted by that one thing, that one person, that one social media post that we hear that we think might be perfect. And I want to take a step back from that. And I want you to really intuitively listen also to yourself as we're finding our path throughout the forest. So let's get going on the 6 pillars, because this to me is why people are here. So we're going to go through all 6, and I'm going to highlight what this means. So first of all, from a nutrition standpoint, I started here because this is everybody's most popular question. And I used to get frustrated, and now I just feel, let's start and let's really answer this question. So from lifestyle medicine, we focus in the cancer space on minimally processed and plant predominant. Now, what does that mean? Well, in the plant setting, that is going to be everything, of course, from fruits and vegetables, but also things like whole grains, seeds, beans, and legumes. We want to have a plate that's predominantly plants. And the reason why is because of the vitamins and the minerals, the fiber, the micronutrients that we get from having all of this diverse color on our plate. It really should be the predominant version. Minimally processed comes into play here because, yes, canned or frozen fruits and vegetables can be completely appropriate. Buying rice off the shelf, even maybe that little parboiled rice, completely appropriate. We just want to focus on as minimal processing as we can. Then we want to make sure that we're emphasizing from a nutrition standpoint, the power of protein. I'll talk a little bit more about that in a moment, but often we forget that our skeletal muscle, that muscle that gets us off the toilet, out of bed, puts our socks and shoes on, gives us energy to go on with our day, as well as exercise, walk safely. Those muscles are only powered by protein. So fruits and vegetables are great, but protein is very important and the only thing that our skeletal muscles truly understand. We want to focus on as least processing as possible. So this really does seem obvious when we look at, burger, fries, chips, sweets, but I think that often processing is very, very sneaky. So I have an app for you that I'll share here in a moment to make this a little bit more fun. And then we want to think about having calorie balance. The average adult in the United States is consuming between 3,200 and 3,500 calories a day. And if we're eating a lot of processed foods, these calories are easy to consume. And this becomes a weight management challenge for our patients. Even living, as Dr. Siegel said, as a metaviver, I do care about body composition because it is your energy and keeping your body healthy to keep going through treatment. So what are my top tips for nutrition? Well, I think if we're going to snack, these are great ways to have whole foods. So I put on here, the cashews, the almonds, this could be peanuts. This could be anything that you can have that maybe has a little bit of a taste to it that you enjoy, but is a whole food. Fruits and vegetables also apply here. But I tend to think that snacks, we sneak to processed foods. And this is a great time that we can actually have whole foods. We also talk a lot about, well, if there is a nutrition plan to follow, what is it? And we lean a lot on the Mediterranean type diet. So that includes whole foods, but it also includes things like olive oil, cheese, yogurt, fish and poultry, and just limited red meat, especially in the space of discussing this with melanoma cancer individuals or even caregivers, with reducing risk of disease. And then for protein, it may be difficult as well as costly to get in protein through just whole foods. So protein supplementation is completely appropriate and often recommended in the space of anybody that I'm trying to increase their protein intake. My goal is I want you to get as much good food as you can. And if it's not perfect, it is totally okay. Those ready to drink protein drinks can be a very, very easy, very economical and tasty way to get into your protein. So how much do you use? I definitely encourage people, especially if they're having challenges with managing their weight, to speak to a dietitian or someone with nutrition experience. But overall, we are starting to push up the protein recommendations in our oncology space because we are starting to understand that skeletal muscle is so important because we are looking at longevity and we're looking at quality of life over longevity. So we want to make sure that we're thinking about getting enough protein. So we look at 0.8 to 1 gram per pound of ideal body weight. Okay. So something that you can kind of think about as a target. If not, you can also look at something as a 1-to-1 protein to carb ratio. You don't have to count. You can. You can also look at this from a portion perspective if it's more simple and easier place to start with. So I like to make food fun. And I recently came across, maybe about a year ago, an app. You can see if you're on the screen in the top left with the little carrot. It's called Yuka, at least to my knowledge, that's how it's pronounced. It's an app. It's completely free. It doesn't have any advertising. You can pay for a premium and it's $15 a year, but you don't have to, and you can have access to so many tools. What this app does, it allows you to scan the barcode of the foods that are on the shelves in your grocery store or take it and kind of peek into your pantry. And it scores this food based upon predominantly processed ingredients or additives. So as you can see here, I have several little snapshots of things that I've taken pictures of, and you'll see that there's a little color code and a score, and then it starts to tell you why. And I think that's really helpful when we're learning about nutrition. So on the bottom left of your screen, you see 2 jars of peanut butter that I found at the Whole Foods. We live in downtown Denver, so often I stroll over to Whole Foods for a few things, and I have this obsession with seeing what's on the shelves. And so the other day I came across, as I was getting ready to grab a little bit of peanut butter, almost picked up the one on the right that says creamy peanut butter spread. And I've had to pause because the labels look so close to each other. And as a consumer, I might think, oh, no stir, great. But what I know about nutrition is a peanut butter spread is going to have something in it that's not just peanut butter, ground nuts. So it's really important that we look at those labels, and the Yuka app can make this very, very simple for you, as you can see. And I picked all things that actually have general shelf stability. The bread per se is not going to be as shelf stable, but all of the other things can sit in your pantry for weeks to months without going bad. And they're all things that you can think about. The protein bar here, I like to put protein bars out because people ask me about what's the best protein bar. My answer is there really isn't a great protein bar. Most of them are actually not a lot of protein. This one has almost 400 calories and only 10 grams of protein. So as an example, there is not a lot of protein in most of the shelf-stable protein bars, but the Yuka app will help you discover that easily. So let's move to exercise. Yes, my favorite topic. However, exercise is not going to be without nutrition. So that's another reason I love to start with that. So rather than give the lecture of 150 minutes of moderate exercise per week, which is the recommendation for any of us on this meeting today, we should all be striving to achieve this, no matter what your diagnosis is, no matter where you are in that cancer trajectory or as a caregiver, we all should be striving to meet this. But I think that that number can be difficult to figure out how to do. So I want to give you my top tips, which are strength training or resistance training is the most important type of exercise we almost all should be doing. And that is because we need that skeletal muscle mass. I recommend 2 to 3 sessions per week. You may ask, how long? My response to you is, it depends on where you are. If you've started, how you feel. I would love for you to do at least 10 to 15 minutes trying to get a little bit of upper body and lower body in. I love multi-joint exercises. So rather than just an arm curl, let's do something where we might curl and press. So we're using more than one joint. But if you sit in your chair and do some curls with soup cans or water bottles, that's fantastic as well. I know we don't always have the perfect equipment, but I love these types of exercises. They have the most bang for our buck. Then I want you to think about things that are functional. Functional exercises are things that can replicate your activities of daily living or things that you do for fun. So as an example, maybe you love taking care of your yard in the summer. Well, an exercise where you're having to lift something off of the ground, even if it's just extending my arms down and I'm holding a pillow, is actually considered to be a functional exercise because it mimics what we want to do or need to do. And I think there's a lot of varieties around this. One of my simplest recommendations for functional is pick up a laundry basket, empty, throw maybe a pillow in there, or put a soup can in there. Wherever your strength is, walk around your house. That is a functional exercise that builds strength, stability, and balance. Now, if you are having balance challenges, you may want to think about a lighter movement or a lighter apparatus or walk near a wall, but these are exercises that you can do on your own. I also put on here challenging. So I put the baby pink weights on because often we think, oh, someone with cancer, they should just take it easy and lift very light. Light is relative. I want you to stimulate your muscles. That might be body weight. That might be 5 pounds. That might be 15 pounds. And maybe picking up a bag of dog food. It's whatever is stimulating to you, but do not be afraid to challenge your muscles. Just find yourself in a safe position to do so. So I don't want you to be afraid of doing strength training. And in fact, in addition to the exercise recommendations we have for anyone on treatment, we have a lot of exercise recommendations that are starting to be in the advanced cancer population, particularly as an example with individuals with bone metastasis. Not only safe, but the risks of sedentary behavior far outweigh the risks on exercise. So I want you to feel empowered. And last but not least, you do need time for recovery. When we exercise, we break muscle down. We need time and nutrition to allow those muscles to build back up. So what do you do to get started? Well, the first thing I tell people is just start. Don't worry about recommendations. Just get moving. I love the idea of exercise snacks. These are 1-minute things that you can do anywhere, anytime. Again, it could be those arm curls. It could be trying to go up a few stairs. It could be sitting on a stool and standing up, whatever they may be. We're going to try a couple of things here, and I'm going to demonstrate them just from my chair with you in a moment. But I also recommend that peek around to see what's on YouTube or if there's virtual classes or programs. I know that often we don't want one more appointment, the time, the logistics, perhaps you have limitations for someone driving you. I truly believe that we have a lot of things out there that are available, and they may not be perfect, but they can at least get you a starting place. And we as individuals know our body the best. And so sometimes just starting with something simple, starting with something less intense in the comfort of our home is a great place to start. Now, I always recommend that, especially if you have balance challenges, you have certain pain with movement, that you do seek supervision. And the reason why is often we don't know our movement patterns. So if you do, there's many, and especially here in 2024, 2025, cancer rehab programs and certified cancer exercise physiologists, cancer exercise trainers across the world. There are some resources that we can provide. They can even just give you a plan, one and done, or you can see them for ongoing, but it is honestly the gold standard. But I also recognize that there are a lot of access barriers. All right. So if you're short on time or energy, we're going to just do my quick little favorite, which is called a Tabata. We're not going to do all 8 rounds because I just want to make sure we get through all of the pillars, but I want everyone to sit up straight in their chair. If you want to stand up and do this, and you can, but what you're just going to do is you're going to start by just marching in place. So although you can't see my feet, I'm just picking up one knee at a time. You can see my hands moving. And we're going to just pick up our bodies in this functional way. In a seated position, I'm working my abs, I'm working my thighs, I'm working my shoulders. If you want to make it even a little bit spicier, you can pick your arms up a little bit. Okay. And then we're going to rest. Now, as we rest for 10 seconds, and I'm guessing on time here because I want to make sure that you can hear me. I want you to squeeze your butt and I want you to relax. Now, I want you to squeeze your butt and relax. Now, notice when I do this, my shoulders are coming up because I'm tightening those muscles that I'm sitting on. Great job. We're all exercising. Let's do it again. Let's just march in place. You want, like I said, you can stand up with this. You can put music on. This can be intense or it can be slow. You can work side to side. I can tell my stool's turning. Good. Keep going. Let's do 5 seconds. And rest. Same thing. Squeeze your tush and relax. Pull those shoulders back, squeeze and relax. One more time. And relax. Great job. So that would be a form of exercise, which is just planned physical movement. And you can even call that an exercise snack should you choose. There's many, many ways to do it. But again, just think about getting started. So pillar number 3, I'm going to take a slight pivot on how we're going to talk about these pillars. Pillar 3 is stress management. This, in my mind, is one of the things that in cancer is always going to be present. It is extremely difficult for us to say, well, just don't stress. As we heard from Dr. Siegel's presentation, even for individuals that have perhaps an early stage cancer that are just in that surveillance or survivorship landscape, wherever that may be, that anxiety is real. And so that stress is going to keep coming back. We know that stress can be acute, short term. It can be in this moment, or it can be chronic. It can be long term. And quite frankly, most of us have a little bit of both every day. The severity obviously will change depending on the circumstances. But I also want you to think about there are healthy stressors and there are unhealthy stressors. So healthy stressors include exercise. They include things like trying to learn a new topic, such as, say, a second language. They include things like taking a cold shower. They include activities of like getting out of your comfort zone. For some people, maybe speaking to someone on Zoom might be a healthy stressor. So I think it's important to note that not all stress is bad. It is very individually defined. But when we experience stress, and this is important to know, we have generally 3 paths of response. And think about that thing that stressed you out, whatever that may have been. It might have been a short-term thing, might have been something with traffic or an appointment or frustration trying to make a phone call, or it might be managing your disease or the disease of a loved one. We, by human nature, do 3 things with our stress. We go into fight mode. We're angry. We're frustrated. We're moody. We're impatient. We go into flight. Don't want to deal with it. I'm going to avoid it. I'm shutting it off. I can't make a decision about anything. Or I freeze. And freeze can be anything from utilizing alcohol. It could be, I just need to scroll through social media, watch Netflix, stress eating, whatever that is for you. We all have a different way to respond to stress. What I want you to think about is a lot of stressors we don't have control on, but some stressors we do. Some of the stressors we self-impose on ourselves. Perhaps as an example, we are not as organized in a certain situation as we could be. We may be trying to do too many things at once and just sort of also not saying no. Over the last 5 years, I've learned I say no to many more things than yes, because if I say no to something, then it allows me to do a yes to something like this, to be here with you today. But what is the most important thing you can do for stress? That is actually going to be breath work or breathing. Why? Because you can do it anytime, anywhere. It helps to lower your stress hormones and it allows you to have rest. There is so many different kinds of breath work. I give you several examples here on the screen, and I give you these examples because everybody likes to sample from a different modality of breath work. Sometimes we connect with certain types of breath work, like a yoga breath. Other times it's like, that's just not something that I can really stick to. One of my favorite types of breath work is to do a session of box breathing. And this is actually what you see on your screen and is actually used to help lower stress response and help provide calm. It's a great tool for sleep. It's a great tool when you're in a moment of going into scanxiety to give you just a little bit of moment of stress relief. And we're just going to try one cycle of this together. So I just want you to get into a comfortable position. Just take a couple of normal breaths. And then we're going to inhale for 4 counts. We're going to hold for 4 counts. We're going to exhale for 4 counts, and we're going to hold our breath for 4 counts. And I just want you to see how you feel. Okay. So here you go. Let's get comfortable. You can close your eyes if you want to, although we can't see you. I want you to inhale 1, 2, 3, 4. Hold your breath. 1, 2, 3, 4. Exhale. 1, 2, 3, 4. Hold your breath. 1, 2, 3, 4. We're just going to do one more. Inhale. 1, 2, 3, 4. Hold. 1, 2, 3, 4. Exhale. 1, 2, 3, 4. Hold. 1, 2, 3, 4, and relax. I often like to do 5 rounds of box breathing because it's easy for me to do the 4 counts on my own. And then I just count through the 5 fingers of my hand. When I worked in clinical practice and worked especially in radiation oncology or transplant, this was one of the things that I would do with patients and teach patients to do, because you can kind of do it anytime, anywhere. Even if you're driving and you don't have to close your eyes, it's a really simple tool that is very, very useful. And then as you can see, there's a lot of different aspects of breath that do a lot of different things that you'll be able to try as well. All right, number 4, sleep quality. Again, a little bit of a moving target. However, it is important to discuss because sleep is where, as an example, our muscles repair, our body heals itself, where our immune system is based. So it's very, very important for all of us to have sleep. What is quality sleep? You can see here, there's 5 bullet points to quality sleep. Although sleep health and sleep hygiene in the clinical world recommends all 5, I personally recommend striving for 3 out of 5 on a consistent or somewhat consistent basis. So you can see what these are. I think the last bullet, feeling refreshed when waking, is very subjective and very difficult to measure in the cancer space, even as a caregiver or healthcare professional. So I think that's really appropriate to just think we're very subjective here. What matters for sleep? Your routines, such as the time that you wake up, the time you go to bed, to try to be consistent. Things that you do in the morning, such as get sunlight, hydrate, try to move a little bit, have a positive or focused mindset of what you're going to accomplish that day. And then the same kind of thing on the bookend, your evening. I think often we just are busy doing things, or we just want to have that sort of relaxation time before bed, but we might be watching a crime drama on TV and we don't realize how that might stimulate our brain. We might be on social media. We might be texting or talking to somebody that makes us feel a little bit more anxious. So one of the things I would love you to think about is your routine in the evening. And then stress management, we just talked about, is really critical for sleep quality, because a lot of times our sleep is impacted by our emotions. And then last, but of course not least, is exercise. Individuals that have regular exercise programs, even if it's 5 minutes a day, have reported much better sleep. There was a study that was published last year. It was a prospective or an after kind of reflective study in patients, and looked at 30 seconds to 1 minute of sit to stands before bed, improving sleep by up to 30 minutes, or the average was actually close to 30 minutes. So I always tell people, sometimes when we sit too much, it does negatively impact our sleep. So the fifth pillar is social connections, which I think by nature, we know that this is important in the cancer space. However, this is all very difficult here in the lens of where we are in 2024, 2025. We are so disconnected, and the mortality of this disconnection and isolation is significant in individuals with cancer. Our mortality is much, much higher because of the isolation. We know that the level of isolation reported in the United States is equivalent to smoking a pack of cigarettes per day. And so I think that we do not realize how much that this is really affecting us. We have this on-demand life. We can do anything on demand, although it's great for today. And when we don't get out and do things, that's definitely a very challenging point. I think the 2 things that I want you to think about for social connections are, 1, having a strong social connection with yourself, your values, what's important to you, even in the moment today. If you don't want to think about this long term, what's important for you for the last remaining few weeks of this year. One of the most important things we can do is to be honest with ourselves. And then I want you to think about who is in your circle. So as a as a wife and a mom and as a professional, I don't always get to choose my circle. So I look for ways to build up the right circle. So I want you to think about my 4 bullet points, which is how you build a circle. What is it you need in your life to feel fulfilled and connected? And this could be you need a little bit of everything, but often we need someone who listens, someone who we can just talk to, lay it all out, someone who encourages us, kind of our pep talk person, maybe somebody that inspires us, that helps us kind of get out of that moment of, okay, I can do this. Or, and honestly, I think this is sometimes happens a lot in these communities, that person that's going to nudge you for it, you can do this. And I think that's really important to think about, what is it you need as a person, wherever you are and coming to join us today, what is important overall. All right, last pillar. Unhealthy or risky habits. So the 2 that I don't think we talk about enough, number 1, sedentary behavior. I just wrote an article for a cancer organization. So it's about sedentary behavior, and the average amount of hours of sedentary behavior in adult in the United States is 9.4 hours. And that was reported in 2022. And so when I thought about that, that just is very scary to me, because we know the implications of just being sedentary and completely resting. Now you can do chair-based exercise. That does not count in sedentary behavior, but true sedentary behavior is definitely concerning and has poor health outcomes. Sugar sweetened beverages. Yes, added sugars do count in this conversation, but I think it's important to kind of say that the research that we have is really looking at sugar sweetened beverages from something that we can measure. Alcohol, I kind of put tobacco vaping under here because I do believe most of us are asked about that on a regular basis, but I do think it's important to mention alcohol. No amount of alcohol is considered to be safe for someone after a cancer diagnosis. However, it's just important that you know that, and that is something that you can make personal choices on. And then I put unnecessary medicines and also supplements in this other bucket. We know that sometimes we're taking a lot of over-the-counter medications. I see this a lot in my space and exercise, people taking things like Aleve or Advil, those non-steroidal anti-inflammatories. Although they can provide pain management, and I think that's very important for individuals that may be having those joint pains or other overall pain, they are also very harmful and slow down the repair of both our skeletal muscle tissue, but our connective tissue. So it's just something that we want to think about as we're looking for pain management strategies. And then supplements, there are so many supplements out there that maybe have a little bit of benefit, but we're just not certain. And I really would like you to consider, why are we taking supplements? What are they for? Do we really need them? Because often they won't be risky, but they seem to be unnecessary, and they could have conflicting, I'm missing the word, but they would be considered to be not healthy for someone that's on certain types of treatment as well. And then, of course, because we are speaking in melanoma, we definitely want to remember that we want to be mindful of sun and sunscreen. All right, pulling it together, what do we know about the pillars of lifestyle in the melanoma space? Well, as I mentioned, lack of really solid research, but significant well-known benefits as we see melanoma patients in larger studies. We know that there's general health and well-being, both physical as well as mental. I didn't really get into the mental health side of lifestyle, but it is significantly growing with research that a healthy nutrition plan following what you learned in Pillar 1 has a lot of benefits, not only for things like cognitive function, but also reducing risk of neurodegenerative diseases that our patients have a much, much higher likelihood of getting. We also know that it can, as we mentioned, reducing the severity of many other chronic diseases. And there's no risk. There's no side effects for doing these interventions. Yes, people will argue with me, muscle soreness, sure, but in overall, we don't have any health risks. And this is really important for most people that really want to think about doing and reducing treatment side effects, short and long term. So lastly, I love to throw this out there because it's a new space that we're starting to see. It's an ongoing in a newer field, but interesting and fascinating in my world, is really starting to understand that skeletal muscle, as we now understand it to be an endocrine organ, can actually help us really look at how treatments, especially immunotherapies, what is the efficacy of immunotherapy for someone that maybe has a certain amount of skeletal muscle versus someone who doesn't. So again, we're just starting to see glimpses in the power of having skeletal muscle. So by following these 6 pillars, you are finding yourself on the right-hand picture in that body composition, regardless of BMI, healthier body composition, more muscle, less fat tissue. That muscle is your engine of life. And so the more that we can understand how to improve that muscle, which by the way, you can do at any point on any treatment, any side effect, you can still improve your skeletal muscle. We just need to get started. So I think it's really an interesting field that I expect to have a lot more good things coming. All right. So where do I start? First of all, just pick 1 or 2 places. Don't start with all 6. Pick 1, maybe 2 if you get really excited about something that you can add on as an intervention. Focus on something that's simple. Focus on accessible. If it takes more than 30 minutes to even come up with a plan to try this new thing, I think it's too complicated. We really want to look in habit change for things that we can do in just a few minutes. So downloading the Yuka app as an example, walking over to your pantry and scanning one thing, that is going to be way more successful than going through a deep dive of what are the best on-processed foods. So think very, very simple in what you can start with. Minimizing expense or time. The biggest thing that I am concerned about in all of lifestyle medicine is we make it very inaccessible. And I want that to not be the case because we understand the power of just small habit change. And then go back to considering don't lose the forest for the trees. Now, in the cancer space on the right, we talk about labs a lot. So if you're looking at wanting to do labs and doing fasting labs, these are labs that I want you to consider and then talk to your clinician about. These can be good measures of metabolic health, which also then helps us understand the overall health of our body and all of our cells. All right. So lastly, I put up, there's a lot of resources that I have. I think we'll share this. The AICR is a great organization. They did a couple of new infographics. Lifestyle Medicine, the College of Lifestyle Medicine has some patient-facing resources. And then I've put out as an example for people looking for exercise on YouTube every Friday, a 5-minute video you can do from home. And I also put out some various things through social media that are all free, accessible on tips and strategies. So please connect with me. I put my email here if anybody has any specific questions or wants any specific research. Other than that, I just want to say how much I really appreciated being here. And I hope that this was valuable and you found some takeaways for you individually and things that you can share with others. Thank you so much.
Thank you, Sammy. I went and downloaded the nutrition app and did some exercises and sit stands during the talk. You probably couldn't tell, but I did. Thank you so much for telling us.
You're welcome. Thank you.